So Niki is our next speaker. She's from the UCD School of Psychology, and I'll just hand over to you now, Niki, to introduce your presentation.
Yes, just a moment, set up my screen. Okay, so let me go. Okay, so hello everyone, I'm Niki Nearchou and I'm based in the School of Psychology. I'm an assistant professor and industrial fellow, and I mostly work with young people, especially interested in identifying factors associated with resilience and how this may impact their health and especially their mental health. So today I will present and discuss findings from our last systematic review paper that focused on exploring the impact of COVID-19 on mental health outcomes in children and adolescents. So the paper was recently published in the International Journal of Environmental Research and Public Health, and the aim was to synthesize and review existing research evidence that looked at the mental health outcomes associated with COVID-19 in children and adolescents up to the age of 18 years old. And the paper is available as a full text for full text access on this link. So regarding the effect of COVID-19, and I will just very briefly present some statistics retrieved from the late UN report that was published in May 2020. So COVID-19 impacted domains of the lives of children, and the most profound impact was in that affected children was regarding to their learning. So it affected education, especially because of the school closures and the other restrictions and disruptions. So what we know so far is that more than 1.5 billion school children have been impacted, which represents 90% of the student population worldwide. What we also know is that there has been a disruption of services, health services and mental health services, and around 70% of mental health services specifically targeting children and adolescents or older adults have been disrupted. And then there is the SAGO pandemic. So there were concerns that COVID-19, all these restrictions and the lockdowns will disrupt the services that were targeting cases of domestic violence and gender-based violence, including violence against children. And indeed, there were reports from multiple countries regarding an increase in domestic violence cases, including children. There is an increase in the demand of emergency shelters and helplines, and also an increase in online sexual exploitation of children. So regarding the psychosocial effects of COVID-19, there has been a wide discussion about the psychological impact of the pandemic on generally on adults. However, there were also some serious concerns expressed regarding how this might affect and the possible debilitating consequences on the mental health of young people. And indeed, we have some findings from UK surveys that were conducted in waves. So one was conducted in March 2020, and then the next wave conducted in the summer, I think it was around July. So the first survey And they included young people with a history of mental health problems. So these young people reported that all this disruption of their daily activities and the school closure introduced day-to-day challenges, and these were associated with the feeling of the loss of structure and support that they received from the school environment, the loss of their routine, and especially the loss of their social connections. The second survey asked young people how do they believe that this and how do they feel that this situation will impact their mental health. So the themes that emerged, there were some qualitative questions. So the themes that emerged were they mentioned that there were reports about anxiety, feeling lonely, loss of purpose, and motivation. And here, this is a quote that I retrieved directly from the latest UN report that was published in November 2020. And it's a quote from a young individual, Mayhem, who is 18 years old from the United Kingdom. And I think that it captures the struggles and the challenges of young people. So many young people, including me, are left uncertain about our next steps, which may be connected to our academic achievements. A lot of us have been feeling like we are no longer in control of our future, which can understandably make us anxious. Another important element when we're thinking about the implications of a pandemic on youth mental health and when we are trying to understand how this might affect young people is the developmental perspective. So we expect that, considering what we know so far, we expect that children of different age groups within this cohort would be affected in different ways. It has been suggested that the lack of regular contact with friends may result to loneliness, and this is a feature that is more present for children that they are in and young people in middle childhood and adolescence. And we also know that school closures mainly impact young people aged between the age of 5 and 18 directly. However, for younger children, so infants and toddlers, they are affected indirectly through possibly the stress that parents experiencing due to this pandemic. And we know from past research that when parental stress is experienced from prolonged periods of time, it can be associated with child behavioral problems, both in typically developing children, but also in children with developmental disabilities. So this brings us to the aim of the present study, the present research. So what we aim to do was to assess the impact of COVID-19 and actually identifying empirical research on this area and synthesize and evaluate this research so that we can get a better picture and a better idea of how this might have impacted internationally the youth mental health, especially of children and adolescents up to the age of 18 years. So the objectives specifically were first to identify mental health outcomes in this cohort associated during this pandemic, but also identify correlates, so factors that might be associated with these mental health outcomes, either positive or negative. So we applied an integrated mixed methods approach because this is an emerging field of research. So we included studies from the qualitative, quantitative, and mixed methods paradigm. We adhered to the Prisma guidelines, and we registered the protocol of the systematic review early with Prospero. This table illustrates the inclusion and exclusion criteria. So as I mentioned, we included studies that were quantitative, qualitative, or mixed methods. We focused only on human studies. We focused only on peer-reviewed papers, and we did not include grey literature, studies that examined mental disorders or neurodevelopmental disorders, studies that focused on any mental health outcome, and of course they had to be COVID-19 related studies, empirical studies. We did not include studies in English, and we exclude studies that focused on adults older than 18 years old. So the search strategy, we included 8 databases, which is quite unusual for a systematic review, but because but this is an ongoing field, an emerging field of research, so we need to capture and identify as many as empirical studies as possible. And also we included the World Health Organization Global Health Research Database for COVID-19, which summarizes all research around the pandemic. The searches were conducted on June 21st, 2020. We set no time limit, and the electronic searches were performed across all the fields of the article. Again, this can be unusual. So we usually focus on title and abstract, but we needed to capture any possible study published in the field. Next stages were screening and data extraction. So we perform 100% double title abstract screening and full text review. And we conducted again 100% double quality assessment using the Joanna Briggs critical appraisal tool and the mixed methods assessment tool to evaluate the quality of the included studies. So this is the Prisma flow diagram that shows how we moved through the selection of the studies, through the screening and the final selection of the studies. So we identified 700 studies, and after excluding those that did not meet the inclusion criteria, we included finally only 12 studies that were deemed eligible for data extraction. So here are the results of the methodological characteristics of the statics in a glance, at a glance. So the 12 studies surveyed 12,262 children and adolescents. The age range from 3 to 18 years old. 7 studies originated from China. All studies applied quantitative cross-sectional designs. 5 studies targeted general population, including subsets of young people, and 8 studies used standardized tools. This table summarizes the mental health outcomes that we identified. So as you can see, depression, anxiety, COVID-19 emotional reactions such as fear, worry, stress, COVID-19 related stress. 2 studies looked at somatic symptoms, 2 studies examined psychological distress, and 3 studies looked at positive domains. So I included here in this 3rd column the prevalence rates that actually were extracted from a subset of studies. However, I just included those here for only descriptive purposes because of the very small number of the studies identifying this prevalence rate, so we cannot make any solid inferences. From the 2 studies that looked at psychological distress, they used the same screening tool, and they classified the majority of young people within normal range. And the studies that looked at positive domains, the 2 that actually present specific, conducted specific analysis on young people, they looked at the sense of belongingness and peer relationships. The main finding when considering that we consistently saw across the 12 studies was that COVID-19 emotional reactions and new social regulations with the lockdown and the restrictions predicted negative mental health outcomes. I will present here, I will just some of these findings, but you can look at the full paper for a more detailed discussion. So I'm sorry, I just have to minimize this. Yeah. So in one study, for example, primary school students perceive COVID-19 as a live and health-threatening disease that is linked to anxiety and somatic symptoms. Another study showed that the fear of COVID-19, so the fear of contracting COVID-19, predicted depressive anxiety and obsessive compulsive disorder symptoms in adolescents. And another study showed that worry about being infected by the virus was linked to an increased risk of depression. But what is interesting is that for those children that felt more optimistic, these acted as a buffer. So they were placed in a decreased risk of experiencing depressive symptoms. We also looked at gender and age differences. In terms of gender differences, there were only 4 studies that examined differences between males and females, and the findings, I think, like any inferences, are rather inconclusive. However, in relation to age differences, 10 studies looked at differences across different age groups within their cohort, and some studies found that older cohorts tend to report higher anxiety and depression and somatization levels when compared to younger children. And what is interesting, that's an interesting finding, is that one study that focused on the general population, but also included young people younger than 18 years old, found that those who were adolescents, and so younger than 18 years old, showed an increased likelihood for experiencing distress when they compared to their older counterparts. So what are the implications of these findings? So how we can interpret them and how we can move forward in terms of designing research in this area. So what we know so far is that, and what we know that the answer to the initial question of our study, is there an impact of COVID-19 on youth mental health? The answer is yes. So this is a consistent finding across the 12 studies that were included in this review. What we also identified is that the reported rates across the studies, even though we know that, we know that there is an impact, we can't capture the exact magnitude of this impact, and we can't know if this impact is associated with the pandemic per se, or there was maybe pre-existing and not associated with the outbreak. And also what it's an important implication is the insight of the association between the COVID-19 emotional reactions and mental health outcomes. So COVID-19 associated stress and worry and fear predicted negative mental health outcomes in young people. So we now know that there is a potential link between these elements.
Niki, I'll just ask you to summarize, maybe take a minute or two. We're tight on time. Sorry about that.
Of course, yes, of course. So this is the last slide. So we actually, our study highlighted some methodological gaps and that we have to consider moving forward. So first we have to focus on children and adolescent samples, and not targeting, so we should design studies that actually are tailored to this age cohort. Studies should use validated and standardized tools that are appropriate of measuring specific variables against appropriate for this age group. Age and gender differences were not examined in depth, and we know that this the demographic profile can be a very important element when we make decisions about the provision of services. especially mental health services, and we also observed a lack of methodological quality, clarity, and rigor that should be addressed going forward. These are the main conclusions. I think I mentioned most of them. So COVID-19, I think I just want to say one thing, that COVID-19 is particularly associated with depression and anxiety, which are high prevalent. It's not unexpected because these are high prevalent mental disorders in this cohort. So thank you very much.
That's brilliant, Niki. Thanks so much. And again, just in the interest of time, I might ask that if anybody does have questions, you can still pop it into the question and answers box, and then we can ask Niki to answer questions by text in the questions box.